The next video we're about to watch is titled Virtue Signaling, Community Service, and Servant Leadership. Virtue signaling is this pejorative term that was used for elites who, through certain kinds of community service, volunteering, and fundraising, signal that they're a certain type of citizen, they're a certain type of human being, they're a certain kind of moral agent. And it was meant in a sort of snarky, condescending way. But I, being as I am, thinks that this term actually exposes or illuminates the admissions process and the expectations for pre-health students in terms of entering a social contract in healthcare and caring for society in which they are a servant, a public servant of sorts, even though they may work for a private institution, and that how they engage with service prior to becoming a professional will foreshadow the kind of professional that they will be. Say, for example, we have students that who volunteer at the Bailey Boucher House, which is the first AIDS hospice in the United States. It requires a year-long commitment. It requires students to show up every week for a certain amount of time. And it requires them to work with a very marginalized population. Now, this population isn't as large as it used to be in terms of how they end up in hospice and because of these antiretroviral cocktails. But nevertheless, when a student is working with whether it be LGBTQI population affected with AIDS or immigrant populations who are being affected by the lack of having, being naturalized, for lack of a better phrase, for having citizenship, or poor kids who are involved in a poorly resourced urban education, it signals to committees the kind of citizen they are. Now, you could think about that in sort of Machiavellian terms as being, very, you could read it in suspicious terms, and that the candidate is trying to manipulate the committee. But there's another way in which if you know this, it can help you think about and reflect upon what are the real moral implications for working with these populations, and how, in working with these very marginalized populations, it can illuminate one's own class, privilege, but also the kind of heart and affect and compassion and empathy that we expect people in healthcare to have developed before they enter professional school.
Virtue signaling is defined as the way in which many people write or say things to make it seem as though they are virtuous. Virtue can be a political cause, volunteer participation, or a moral stance. We are in a unique space where it is easier to appear good than it is to do good. Social media allows us to bandwagon on a cause or associate ourselves with a particular group, gaining affection for it. Yet, are we doing any good for that cause or group, or are we merely elevating ourselves at their expense? There is no easy answer. The Ice Bucket Challenge, a great example of virtue signaling, drew attention to ALS and raised over $88 million in research. Yet the focus was not on patients, nor clinicians, nor researchers. It had morphed into a meme. So what does this mean for PPHS? On one hand, virtue signaling is a necessity for us. The causes we interact with and associate ourselves with are a signal to admission staff that we are virtuous, caring people. We are cultivating causes that act as stamps of virtue for admission staff. So this should make us be conscious about the causes we associate with, and conscious about how those causes make us appear. Now, you may be raising some severe objections. Let me first point out how we are forced to write down all the good we do on our application and talk about it in order to get into medical school. There is no way to avoid virtue signaling, even if it seems wrong. So there's a necessary balance between doing and talking. However, there's a deeper, more personal question here. Are we volunteering or pursuing medicine for the sake of goodness, or are we merely doing it to benefit ourselves? Are we volunteering just to get the right number of hours for medical school, or are we sacrificing to care for someone? I think that true acts of service need to involve some sort of sacrifice, and should be done with an open and generous heart. Virtue signaling should lead us all to reevaluate our motivations for doing good, and assess the ways in which we benefit from the good that we do.
The biggest difference between volunteerism and community service is the heart behind it. Volunteers are willing participants, those who choose to serve in areas of need. Many people think about volunteering and equate being in the presence of suffering and sadness as a successful, meaningful, authentic experience. While raw emotions can be present at the forefront of volunteering, it is not the only thing students should be chasing. Authenticity in these cases is defined as sincere, essential, natural, and real, an individualistic aspiration informed by global modernity. To most students, volunteerism is a display of dedication and passion, as well as global exposure and urbanity. Those who serve will be more aware of the needs in their community. They get to experience others, and it informs and shapes how they will now see that community and the communities around them. However, some see volunteerism as a social responsibility, a responsibility for those who are more fortunate to experience the need of those who are less fortunate, and to then intervene and help them. But as Chun Yi Sum stated, volunteering is an individual act in response from the heart, not something that students should do begrudgingly or without any altruistic desire behind it. Volunteering at its core is altruistic in nature. Volunteering is not about self-cultivation or self-fulfillment. It is about being genuine in our desire to help others and build communal connections with those around us. These connections then help students to become better equipped to serve in the healthcare profession as people well-versed in cultivating meaningful experiences with both patient and coworkers alike that we will come in contact with.
Volunteering and becoming involved in the community is a significant factor that professional programs take very seriously, but how that correlates to medicine may not be so clear. In a chapter titled Community-Oriented Medical Education, the authors helped elucidate how community involvement, particularly in medicine, can lead to overall improvement of communities. There's been this long-standing idea that physicians are not fulfilling the social responsibility to improving health, which is most likely due to the lack of education in responding to changing societal health needs. However, becoming involved in the community allows students to learn the needs of the people they will be treating. Social determinants are a large factor contributing to poor health outcomes, and these cannot be fixed without direct interaction and identification of the causes of those determinants. So to some it may seem like just another day of volunteering, but the perspective you gain from community members that do not live the same lifestyle as you can be so beneficial to the advancement of health. The University of Toronto has actually implemented community-oriented medical education into their curriculum to help understand, promote, and eventually achieve health in their community during this three-phase process. This has allowed students to identify particular areas of the community that they believe they can improve, as well as understand the broader context of the healthcare in that community. This sort of implementation into the community is exactly what the SPU PPHS program strives to do. It is up to students to dive into the community they are now a part of in Seattle and learn the needs of the people surrounding them.
According to Margaret Brown, a psychology professor here at Seattle Pacific University, says that it is in our human nature to establish and maintain group-based hierarchies. Social dominance orientation, or SDO, is the degree to which an individual has a preference for social hierarchy. Hence, high levels of SDO would contribute to racism, sexism, and other equity issues. Service learning has been initiated in order to help promote long-term community service, civic interactions, and experiential learning. Dr. Brown conducted research on how students are able to learn from service and whether helping behaviors affect the perception of power between different groups. She randomly assigned college students in a general psychology course to either a service learning group or a control group. The service learning group participated in 18 hours of a helping experience over a 9-week period. After the 9 weeks, the service learning group showed a decrease in SDO compared to the control group, in addition to a higher level of empathy. Dr. Brown found that empathy mediated the relationship between helping and SDO. If students engage in service learning early on in their various educational experiences, this then could foster lower levels of SDO before it becomes solidified as they transition into adulthood. Service learning would be a powerful tool in helping to reduce the number of barriers between the different and diverse groups in every community.